Hello and welcome to this video in which I'm going to share some myofascial exercises that can help with headaches and migraines. There are many different types of headaches that people can suffer from. Very typically they can be tension headaches, cluster headaches, New Delhi persistent headaches, or migraines, which are in themselves a form of headache. The symptoms that you can suffer from vary widely, and the causes can also vary widely. However, for many people, the main cause of their symptoms is tension in the soft tissues in the body. So that's the muscles and the fascia, which is the main connective tissue that wraps around and through everything else. And if your fascia becomes tight, then that can start to create imbalance and tension. And for headaches, very typically around the neck, upper back, shoulders and chest. So these exercises that we're going to do can help to start to release some of the restrictions in this area and hopefully help to alleviate some of your symptoms. The first exercise we're going to do is a neck stretch. So make sure that you have your arms hanging by your sides, nice and heavy, and keep your shoulders heavy and relaxed. You can do this exercise seated or standing, whichever is more comfortable for you. So we're just going to start to bring our head over towards the side, bringing your ear towards your shoulder. So when you start to do this exercise, it can be a good idea to do this looking in a mirror at first, because then you can check that your shoulders are actually staying relaxed and level. Many people start to tip their shoulders up as they go into the stretch, and that obviously will reduce the effectiveness of the stretch. Keeping your shoulders nice and relaxed means that your body can start to release and let go of restrictions more easily. So when you go into the stretch, you only go as far as feels comfortable for you. As soon as you start to feel any restrictions in the tissues, then you wait at that point. Forcing a stretch will only cause resistance in your body. And with these stretches, you're encouraging the fascia to start to release and let go. Fascia is a very slow releasing tissue, so you can be in one stretch for at least a couple of minutes to allow time for the fascia to release and let go. As you feel the tissues releasing more, you can deepen the stretch. And if you want to create a deeper stretch again, then place your hand on top of your head. So I'm not pulling, I'm just allowing the weight of my arm to create a deeper stretch into my neck. So you may feel the stretch more in your neck or your head, or some of you might feel it more in your shoulder or your arm or somewhere else in your body. So wherever you're feeling it, that's fine, that's right for you. And just allow time to feel that stretch and release spreading through your body. So as long as you're here for at least a couple of minutes, then the fascia will start to release and let go. And then we're going to come out of the stretch. And you can just give your shoulders a little roll. And maybe turn your head from side to side, just to allow the effects of the stretch to assimilate into your body. And then we're going to do the same stretch on the other side. So again, tipping your head over to the side so that your ear is traveling towards your shoulder. only go as far as is comfortable, and notice the difference between the two sides. You may find that one side is tighter than the other, and it may not be the side that you have more pain or issues on, because your body can often compensate where there's one-sided pain. So keeping your shoulders and your arms nice and relaxed and heavy, and just allowing time for the fascia to start to release and let go. And as you start to feel more release, you may find that you can deepen the stretch just by tipping your head more over to the side. So this exercise releases the muscles and the tissues in the side of your neck and your shoulder and your upper back. And all of these can contribute to tension that you feel in your head. And if you want to deepen the stretch, again, you can bring your arm up. Place your hand on top of your head, and just allow the weight of your arm to create a deeper stretch without pulling or forcing the stretch. So all fascial exercises are very slow, gentle, and progressive. The longer you're in a stretch or an exercise, the more the fascia will start to release and let go. And as it releases, this allows all the tissues and structures that are held within it to start to release as well. So that's the muscles, the nerve endings, the blood vessels can all release and become more elastic and move more easily. So again, as long as you're in the stretch for at least a couple of minutes, then the tissues will be starting to release and let go. And so we're going to come out of the stretch. Again, give your shoulders a little roll. Turn your head from side to side. And the great thing with fascial exercises is that you only do each exercise once. It's one long progressive stretch as opposed to a series of shorter muscle stretches. The next stretch we're going to do is also for the neck. And for this one, we're going to tip our head down so that your nose is pointing down towards the floor. And then turn your head so that your nose is pointing towards your armpit. So just let your head hang heavy here. And again, making sure that your arms and your shoulders are nice and relaxed. And allowing the weight of your head to create a nice stretch into the back of your neck. So the back of the neck can get very tense and is one of the major areas that can contribute towards headaches and migraines. And particularly if you have developed headaches as a result of an injury, so perhaps a whiplash injury or something similar where your neck has been affected, then these stretches can really help to start to release some of the tension in the tissues and therefore help with headache symptoms. So as you're here, if you feel that you'd like to deepen the stretch a little bit, then again you can bring your hand up so you place it on your head. So my hand is on the top of my head and the weight of my arm is creating a deeper stretch into the back of my neck. And if I'm stretching with my head turned to the left, I'm going to feel the stretch into the right side of the back of my neck and my shoulder. So you're creating a stretch into the opposite side. You may find that you feel symptoms or releases elsewhere while you're doing this stretch, and that's also fine. Everybody is different, and so where you feel releases is fine for you. So we're going to come out of this stretch, bringing your head back to center again, rolling your shoulders, and just turning your head from side to side. And then we're going to do the same stretch on the other side. So again, dropping your head down so your nose is pointing towards the floor. Turn your head so your nose is pointing towards your other armpit. And let your head hang heavy, keeping your arms and your shoulders nice and heavy too. And just allowing the weight of your head to create the stretch. So with fascial stretches, never force the stretch, never take the stretch into pain. You only go as far as is comfortable for your body on that day. And you may find from day to day that your body changes. And some days you find that stretches are really easy, and other days they may be a bit more difficult. But that's all okay because your body will change, and if you do fascial exercises regularly, you'll find that your body will start to progressively respond by releasing more of the tension. Again, making sure that you stay in each stretch for at least a couple of minutes to allow time for the fascia to release and let go. And if you want to deepen the stretch, you can bring your hand up and place it on your head. And just allow the weight of your arm to create a deeper stretch going down into the back of your neck. And noticing how things feel. Where do you feel releases? How does your head feel? And then we're going to come out of the stretch. Bring our head back to center. A little shoulder roll and turning your head from side to side. In this exercise, we're going to use a myofascial ball like this to work on the side of our neck. So myofascial balls are very helpful because they are inflatable. They're about 10 centimeters in diameter, and so they can give a nice diffuse pressure to the soft tissues, and this can help to encourage fascia to release and let go. So for this exercise, I'm going to place the ball on the side of my neck so that the ball is just below my ear. And I'm going to lie on my side on the floor. So in this exercise, it can be a good idea to use either a yoga block or a small pillow to put under the top of your head so that it feels comfortable. And it's also a good idea to pull your bottom arm forwards so that your shoulder is out of the way. This means that there is pressure on the ball on the side of my neck. And I'm just going to allow my body to relax around the ball, waiting for a sense of the tissues softening and letting go. If you find that it's uncomfortable to lie on the floor, then you can do this on your bed as well. The main thing with fascial exercises is always to make sure that you feel comfortable so that your body can actually relax onto the ball. So we're going to be here for a couple of minutes in total. And this allows time for the fascia to start to release and let go. And just notice any sensations that you may feel. The muscles in this area are on the side of the neck, and also in this area are some nerves that go down into your arm. So sometimes some people feel some sensations in the arm, and that's absolutely fine. Or you may notice sensations more coming up into your head or round into your shoulders. So whatever you're feeling is fine, just allowing time for your body to release and let go. And then we're going to come out of this exercise and do the same on the other side. So again, on this side, maybe using a yoga block or a small pillow to support the top of your head, and bringing your bottom arm forwards so that your shoulder is out of the way. And this just means that you can actually feel some pressure from the ball on the side of your neck. So as with all fascial exercises, you only need to do the exercise once on each side, but staying here for at least a couple of minutes to allow time for the tissues to start to release and let go. And just noticing what you feel here. So by working here on the sides of your neck, you're helping to create more movement in this area. Sometimes when you have headaches or migraines, everything becomes very tense around your neck and your shoulders. And a lot of people say that they find it's quite difficult to turn their head or to move the head. And certainly certain movements can trigger headaches or make them feel worse. And there's lots of muscles and tissues around the side of your neck that help you to turn and tilt your head. So by helping to loosen these, you're creating better range of movement, which will feel more comfortable, but also can help to alleviate some of your symptoms. And just allowing yourself to relax around the ball, waiting for a sense of things starting to soften and let go. And so once you've been here for at least a couple of minutes, we can come out of this exercise. In this exercise, we're going to use two myofascial balls together, and we're going to place them under the back of the neck. So to make this easy, then it's a good idea to place the balls into a bag or a sock so that they stay together when you put pressure on them. I'm going to lie on my back with the two balls under my neck. Again, I have a small yoga block here that I am using as a pillow for the top of my head. So lying on your back, you can place the 2 balls under your neck with 1 ball either side of the spine in your neck. Having the balls here just means that it is comfortable. You're not putting pressure on the spine, but you are putting pressure on the soft tissues, the muscles and the fascia in the back of your neck. So at home you can do this on the floor like I'm doing, or you can do this on your bed, whichever is more comfortable for you. You can have your knees bent, or you can let your legs straighten out. So the area in the back of your neck is important because there are muscles and tissues that travel all the way up your back, connecting your pelvis to your head. And here in the back of your neck, a lot of the tissues connect into the base of your skull. So the tension that you feel in headaches or the pain that you can get can be coming from tension in the tissues in the back of your neck. This is a lovely relaxing exercise to do. Not only can it help to alleviate pain and other symptoms, it also helps to relax your nervous system. And the more relaxed your nervous system is, the less pain and tension you will feel. So this exercise in particular is a really good one to do at the end of the day, particularly if you've got a headache towards evening time. And by doing this, it can help to loosen the tissues, and that can help to alleviate your headache, particularly before you go to bed. And again, as long as you're here for at least a couple of minutes, it will allow time for the tissues to start to release and relax and let go. So in this video, I've showed you a few myofascial exercises that can help with headaches and migraines. We have lots of other short videos on our YouTube channel, which are all focused on different areas of the body and different pain conditions. So why not visit our YouTube channel and have a look at some of the videos that we've got there. And if you're interested in getting one of our myofascial release kits, which contains the myofascial balls, then you can find these on our website.